Librarian Mr. Muhammad has recently been diagnosed with thoracic outlet syndrome. Thoracic outlet syndrome describes a group of disorders that occur when there is compression, injury, or irritation of one of the three categories, including arterial, venous, or neurogenic, which may occur in the lower neck and upper chest area. Work-related thoracic outlet syndrome occurs due to compression of the brachial plexus. Some of the symptoms include weakness or numbness of the neck, chest, arm, or hand, pain, tingling, prickling, or decreased size of hand muscles, usually on one side of the body. This condition has interfered with Mr. Muhammad's job performance and day-to-day tasks. Luckily, Mr. Muhammad has been referred to the OT Dream Team to get back to his prior level of functioning.
Hello, Sophia.
Hi, Jovine. This is Sophia. I have a referral for you guys. Okay, so basically, we have a client. His name is Mr. Muhammad. He's a 45-year-old male who works as an academic librarian, and he was diagnosed with neurogenic thoracic outlet syndrome in his right upper extremity, around his lower neck and upper chest region. He had complaints of pain in his shoulder and neck. He had weakness of the right arm, and he had some tingling feeling throughout the extremity. He is unable to complete the repetitive actions of placing books back on the shelves higher than shoulder level, and when he carries heavy boxes, he complains that it hurts way too much. He was diagnosed by the therapist, and the results were positive. And I also myself performed an elevated arm stress / roost test, and the results were positive. He was independent in all ADL and IADL tasks before this injury. And on a normal workday, he was required to reach with his hands and arms. He had to stand, sit, walk, use his hands to and fingers to grasp handles and stuff like that. And he has to be able to hold up to 20 pounds. So I'm just asking you guys if you can provide any more recommendations for his condition. Because right now I'm just addressing pain management and some therapeutic exercises, but I also want to see what else I could do to help him out.
Oh, some recommendations for thoracic outlet syndrome? Oh, actually, I have two OTs with me here, so I'm just going to put you on speakerphone so that we can all give you recommendations, okay? All right.
Okay, great. I'll send you the information right now.
Yes.
Okay. So, sounds like Mr. Muhammad has a lot of repetitive movements going on when he is being a librarian. So, he's repeatedly extending his arm when he's placing his books on the shelves, and he's lifting boxes of equipment which are probably heavy over and over again. So, some ways we can intervene is incorporating a stepladder to reduce the angle of extension when he's shelving his books. You can also utilize a rolling cart to transport heavy items, books, equipment, just to reduce the pressure of his arm. And also, when he's at his desk, he could place his items within a comfortable reach to reduce strain on his arm.
Alright, let's see. So for static exertions, for this patient who has thoracic outlet syndrome, some of the stuff that he would be experiencing, some issues would be like standing on a step stool or ladder when placing books on a high shelf, and filing and sorting mail on the client's desk and mailbox. As for intervention, we think that it's important to educate the client, Mr. Muhammad in this case, on safety awareness. Can you hear me, Sophia?
Yeah, I'm here.
Okay, on a step stool or ladder, and recommend refraining from standing on stool for a prolonged period of time. And also, we would recommend to have an organized system of filing and sorting mails out, so that way he doesn't have to go back and do things back and forth. And it's also a good way to look up on energy conservation.
Good idea.
Yeah.
Okay. Well, since he has to carry a lot of books, he has to lift heavy boxes from the floor to the cart. That's one of the issues that he might be encountering, and he would have to do extreme shoulder elevation, retrieving and placing books on a high shelf, and also pushing a heavy loaded cart with a lot of books and boxes in it. So some of the interventions would be educating the client on proper body mechanics when lifting heavy objects from the floor, And I would recommend using a step ladder or a stool when putting away or retrieving books from a higher shelf instead of them overreaching or maybe using their toes, which is highly unsafe. And then another recommendation would be filing the cart with a manageable load instead of overloading it, so that he can push to his limits instead of over pushing himself.
That's true. All right, so for posture stresses, again, Mr. Muhammad, something that he would have to, come across would be standing for prolonged periods of time when putting away or retrieving books, and also seated in a kyphotic position when filling out inventory for incoming books. As for interventions, something that we would have to incorporate and let him become aware of is taking seated rest breaks, because it's really important to also take rest breaks as you're standing the whole day and doing a lot of movements, repetitive movements. Your body also needs to rest. Also educating Mr. Muhammad on proper sitting position in order to reduce the risk for kyphosis. So proper body mechanics when sitting, you want to make sure he has a really good posture. So yeah, those are some of the things that we would incorporate into his daily plan.
Right, so some localized stresses that he might encounter is weight bearing on his knees when putting away or retrieving books from a lower shelf, and also the repetitive grasping of the books and boxes when filing them. So what I would recommend is using pads for the knees to prevent heavy weight bearing on the knees, because in the future he might have some problems with his knees because he put too much weight on it while he's stacking and putting away the books. And another recommendation would be taking rest breaks and attend to other tasks to reduce his stress on grasping the books.
That's good.
Yeah.
And just to wrap it up, Sophia, so these are the things that we do recommend for Mr. Muhammad. And again, this is for him so he is able to go back to his everyday routine, and so he is able to do things that he was able to do prior to experiencing thoracic outlet syndrome. And again, as OTs, we got to make sure that he is able to continue to participate and engage in these meaningful activities in order to have a happier life and being able to do the things that he could prior to this condition.
Thanks, guys, so much.
Sophia, I'll send you up a recommendation list and send it your way.
Thank you so much, and I'll be looking forward to getting that recommendation list from you, Taylor.
All right, bye.
Bye.
See you later, bye.
After checking in with Mr. Muhammad, it was evident that he took some of the OT's recommendations. Mr. Muhammad was educated on proper body mechanics when lifting heavy objects from the floor. He also utilized a rolling cart to transport heavy items and equipment to reduce pressure and filled the cart to a manageable load rather than filling the cart to capacity. He also incorporated a stepladder when putting away or retrieving books from a higher shelf, which reduced his strain. Through OT intervention, Mr. Muhammad has been able to participate in the activities and tasks that make up his workday with reduced pain and stress on his body. If an occupational therapist can help Mr. Muhammad, just imagine what OT can do for you.